Good day, sir. I am Shella Burwell from BSN 1Y3 T2B. So for today po, I will perform a return demonstration on applying hot compress. So our objective for today's return demonstration is to apply heat therapy safely and effectively to promote circulation, relieve pain, and muscle tension, and also provide comfort while preventing burns and skin damage. So I will proceed first po by verifying the client's identity using 3 identifiers to ensure correct client identification. Good morning, ma'am. I'm Shella Burwell po, your student nurse for today. May I ask you po, what is your name?
My name is Cassandra Nicole T.
What is your birthday po?
June 7, 2013.
Pwede po ba makita yung response nyo? Okay, thank you so much po. So now naman po, I'm going to verify po yung order for type of application, which is yung heat application, and yung location, which is nasa lower limb daw po, and yung duration po and desired temperature. So na-ensure po natin dito na correct po yung procedure na gagawin natin kay client. Next naman po is i-review ko po yung client's chart for medical history and yung contraindications that may prohibit po yung use of hot and warm therapy. So, na itulong ko before na kapag po hot therapy po yung ginagamit natin is meron pong pain pero wala po dapat inflammation. So, i-check ko po yung chart para din po doon sa kanina po yung type na application. And now naman po is yung medical history ni client. Like if meron po ba siyang inflamed area sa kanyang lower limb na may i-inhibit po sa pag-use ng hot therapy. Now naman po is i-assess ko na po yung client's skin and around the area po to be treated and yung client's temperature na rin po and pain sensitivity. So first, yung area po to be treated is nasa lower limb niya. So ma'am, okay lang po, titignan ko lang po yung area niya po. Sa left lower limb niya po is meron parang muscle tension po dito. Ma'am, gano'n po kasakit yung nararamdaman niyo? Your scale of 1 to 10. Yung 1 yung pinaka-lowest and yung 10 yung pinaka-mas po. 10 po. I will take note of that. So as I can see naman po, wala naman po swelling and redness that may indicate infection or inflammation. Now naman po is, na-inspect ko na din po yung if meron pong wound si client dun sa area, and if meron po yung size po ng wound, yung color, yung odor, and tenderness, and drainage. Since wala nga pong wound si client dun sa area na i-apply po natin ng hot compress is, I will proceed with the next po is yung assess the client's and family's awareness, understanding din po and of the procedure and related safety factors. So ma'am, ever experience po na makapag-apply po ng hot compress po before? So I will explain po and answer po if meron po kayong questions regarding this procedure po. So ma'am, may mga questions po ba kayo? So yung family niyo po ba nakapag-apply na po ba sila ng heat compress or hot compress po sa inyo? Okay, so next naman po is i-assess ko din po yung vital signs po ni client and yung mobility niya po. So kanina po sa chart po niya, na-assess ko po na mobile naman po si client but nahihirapan na po siya ngayon since meron pong muscle tension sa kanyang lower limb, sa kanyang left lower limb po. So now I'll proceed sa vital sign po. Okay po, upon assessing po kanina, nakuha ko na rin po yung kanyang RR, which is nasa 14 po, and it is considered normal. And we will continue na po with our next procedure, which is i-identify ko po yung mga expected outcomes. Ma'am, so magkakaroon po tayo ng heat therapy po or hot compress sa left lower limb po, which is nagkakaroon ng masakit po or yung muscle tension. So ngayon po, ang expected outcome natin is magkakaroon po kayo ng relief dun sa pain, mababawasan po yung tension dun sa muscle, and hindi po kayo dapat makaranas ng mga problems like mas lalong sumakit po. Mababawasan po kanina, sabi niya 10 po ang pain rate niyo po, dapat po bumaba po siya after the hot compress. Yun lang po yung expected outcome po natin. Next naman po is i-assemble ko po and yung i-prepare ko po yung mga equipment na kailangan po. So, na-prepare ko po dito yung basin po na meron po hot water or yung hot water na meron dito or enough po dun sa temperature na sinabi po dun sa chart ko. Then, meron din po tayo dito yung towel po na gagawin din na po natin later, and meron din po tayong dry towel here and an absorbent pad. So now naman po is i-explain ko po yung procedure kay patient and kukunin ko po yung approval niya for this procedure. So ma'am, kanina po nasabi ko po na magkakaroon po tayo ng hot compress. Since hindi niyo po ito nagawa before, i-explain ko lang po yung gagawin po natin para hindi po kayo mabibigla later. Okay lang po sa inyo, ma'am. So ma'am, ang gagawin po natin is maglalagay po tayo or may ibabawal po na tawag po sa mga isa-isang pelanggan or basin. Then ilalagay ko po yun, i-compress ko po yun sa area na meron pong muscle tension, which is sabi niyo po kanina, yung left lower limb nyo. So ang gagawin po, yun pong ilalagay natin po doon, tapos hanggang sa mawala po yung sakit na nararamdaman po doon. Meron po ba kayong ibang tanong, ma'am? Okay lang po ba sa inyo gagawin natin? Thank you so much po. So, Noon naman po is i-describe ko rin po yung sensations na mararamdaman ni patient and yung precautions po to prevent burning. So ma'am, makakaramdam ko lang po kayo ng slight cough probability since mainit na po yung lalagay natin. Pero may make sure naman po natin na hindi po kayo magkakaroon ng skin burns or skin discomfort. So yung mga precautions po natin or yung mga piniprevent po natin dito is bawal yung pong yung pinaprevent po natin dito or precautions na meron tayo dito is hindi po natin lalagyan ng compress if inflame po yung area. Okay lang po sa lang. Thank you so much. Next naman po is, ipaprovide ko lang po yung privacy sa kanya by closing the doors and closing the curtains around the bed. So, na-close ko lang po yung bed. Next naman po is, ipoposition ko po si client in bed, kept affected body part in proper alignment. While expose ko lang po yung body part na kailangan pong i-treat. And i-treat ko po yung patient if needed. So, na-position ko lang po kanina si client, which is sa supine position. And na-raise ko na din po yung bed, as you will. So, i-treat ko na po, or titignan ko na po yung area kung saan i-treat ko natin. Okay lang po, ganito po. So, next naman po is mag-perform po ako ng hand hygiene and apply po ng gloves. Next naman po is mag-replace po ako ng absorbent pan under po doon sa area na i-treat ko natin. Using this underwood method. Pwede po nagpalit. Next naman po is, mag-apply na po ako ng heat compress dun sa affected area and imumugod ko siya over the side. So, na-prepare ko na po ng heat compress. Na naman po is, i-ano ko siya. Imumugod na po dun sa area since sa may muscle tension. So, yan po. Next naman po is, since alam ko po yung mga precaution, I will stop the application immediately if meron pong incident or problem na occurs. So, if masyado po naiinitan si client, hindi niya po matolerate yung pain, just stop po ito immediately. Ma'am, kaya naman po yung init. Okay, thank you so much po. Now, I will inspect po yung body part or yung wound condition for evidence po of effectiveness ng therapy and sensitivity to touch. So, as I can see po, medyo nawala po yung pagkaka-tension mo or medyo may relief po kay client. Ma'am, kung i-rate po ulit natin yan from 1 to 10, kung 1 yung nakalawa sa yung highest sa sakit, gaano lang po siya kasakit naman? 1 na lang po. Okay, thank you so much po. Next naman po is i-ask ko po kay client yung i-describe niya po yung level of comfort niya and yung burning sensation following the treatment. So, ma'am, how do you feel now po? May relief na po ba kayo or hindi mas kapal po? Okay, okay na po. Okay, so, wala naman po, hindi naman po yung sa container. Okay, thank you so much. Next naman po is i-obtain ko po yung vital signs niya and i-compare po yung baseline kanina. So, ito po yung dry towel natin. Para na rin po pag... So, i-copy ang mga vital signs niya. Ang palagay po. Next naman po is i-identify ko po yung mga unexpected outcome. So ma'am, kanina po yung mga expected outcome, nasabi ko na po sa inyo, yung mga kailangan or yung mga feeling after the process. So, syempre waiting pa rin po tayo na ma-relieve yung pain now. Pero during that waiting po ma'am, if ever po na maka-experience kayo na naging maga po yung paan nyo or yung lower limb nyo, and mas sumakit po na or tumaas yung pain na naramdaman nyo, that would be the unexpected outcome po. Pero if ever po na makaranas kayo, please tell us or inform us po. Wala kayo po yung ma'am? Thank you so much. Now naman po is the-document ko and report all pertinent information and procedure performed po. So, I'll document po kung ano yung type ng procedure na ginawa ko. If hot compress, since hot compress po yung ginawa ko, ano yung characteristics po ng tension po kanina, and ano po yung naging after po ng procedure. And that will be all for my return demonstration on hot compress. I will not take off my gloves to prevent the spread of microorganisms. Good morning, sir. I am Shella Burwell from BSN 1Y3T2B. So for today po, I will perform a return demonstration on applying cold compress. So our objective for today's return demonstration is to apply cold compress safely and effectively to reduce pain and swelling and also inflammation while maintaining patient safety and comfort po, while also preventing skin injury. So I will proceed with first verifying the client's identity using 3 identifiers. So, good morning, ma'am. I'm Shella Burwell, your student nurse for today. May I ask po, what is your name?
My name is Cassandra Nicole Peter.
What is your birthday po?
June 7, 2005.
May I see your wristband po, ma'am? Kung nasa kamay po. Okay, thank you so much po. So that to ensure correct client identification. Next naman po is I'm going to verify the doctor's order for the type of moist, cold application, yung location po, and duration, and yung desired temperature. So as na-verify ko na po yung doctor's order a while ago. So ang in-order niya po is yung location is ang may bandang left-hand ni patient. So doon ko po i-apply since meron po siyang parang swelling po doon. And now naman po is I'm going to review yung client's chart for medical history and contraindications that may prohibit the use of hot or warm therapy. So I've already reviewed the charts po for medical history po para ma-make sure po natin na akma po yung ginagawa natin for the patient. Next naman po is I'm going to assess yung client's skin or around po sa area na to be treated and yung client's temperature and pain sensitivity. So kung okay lang po ba, i-check ko po yung area na pinaka-conflict no? So, as I can see po, medyo namamagamma po nun. In a rate of 1 to 10 po, yung scale of 1 to 10, yung 1 po yung pinaka-lowest, while yung 10 po yung pinaka-highest. Ano paano po i-rate yung pain po? Paano po siya kasakit na? In a rate of 1 to 10 po. 9 po, sige po. I'll take note of that po. Next naman po is I'm going to inspect po yung wound if any po for size, color, odor, tenderness, and drainage. Since hindi naman po siya wound and swelling po siya, I've already checked po if may wound po si client. So, there's none naman po. Next naman po is i-assess ko po yung clients and yung family's awareness niya po and understanding for the procedure and related safety factors. So, about this procedure po, do you understand po bakit po parang yung ginagawa to? Or alam niyo po siyang gawin sa bahay? Nagawa niyo na po ba siya before? Sige po. So i-assess ko din po yung family's awareness niya po regarding sa procedure and hakalaan po sana silang manood para po in case na nasa bahay na po kayo and nakaramdam po kayo ng swelling, ilan po nila yung gagawin na. Okay lang po ba sa inyo na? Okay po, thank you po. Next naman po is i-assess ko po yung client's vital sign and mobility. So, si patient naman po is mobile naman po siya, nakakagalaw po, according sa kanyang patient's chart. Nakakagalaw naman po kayo. And yung vital signs niya po, so, now po, ano po yung vital signs niya? So, first, temperature. So, yan lang po. Then, kanya ko isa po. Masabi ako, wala po. Then, bigla po siya kakar. Para mag-ibig pa sa institution. May para dito. So, make sure po natin lahat ng ginagamit natin ni client is minimity po natin yung proper hygiene. So, next naman po yung kanyang BP. Tapos, kaya po naman siya first. So, hindi ka mag-guys, yung normal case ko. After that naman po is I'm going to, after that po ng kanyang vital signs is, i-identify po natin yung expected outcome. So, as we apply cold compress, we expected po na malilesen po yung swelling dun sa area or location ng may kamamaga po, and ma-reduce yung pain na nararamdaman po ni patient. So, next naman po is i-assemble natin, i-prepare po natin yung equipment and supplies if needed po. So, I've already arranged po dito sa kanyang bedside stand or overbed table, yung basin po, and yung mga extra towel, yung gauze pad, and yung waterproof pad, and also yung pair of gloves and alcohol. Next naman po is i-explain ko po yung procedure to the client clearly and completely with client's approval po. I-describe ko na rin po yung sensation na ma-feel po ni patient and yung precautions po to prevent friction and or numbness. So ma'am, today po, ang gagawin po natin is mag-a-apply po tayo ng cold compress doon po sa area na namin na pamamaga po sa inyo. So, ang feel niyo po is parang malamig po syempre po and if ever po namin ma-feel po kayo slight pain or pain po, sabihin niyo po sa akin. Iwasan din po natin na igalaw-galaw po muna yung kamay po na meron swelling and or matabulin po siya ng mga bali, hindi pwede. Na mga mabibigat na bagay. So, yung ma-feel niyo po is slightly uncomfy po pero make sure po na mabawasan po yung pain po nila ng naman. Would that be okay with you, ma'am? Okay, thank you so much po. Next naman po is, ipaprovide ko natin yung privacy all times. And so, by closing the curtains and closing the doors. Ipoposition natin si client in bed, yung affected body part niya po in proper alignment, and expose natin yung body part to be covered. Itadrape din po natin si patient as needed. So, naka-blanket naman po siya. And then po yung area po na meron po siyang swelling. After that is I'm going to perform hand hygiene and apply clean gloves. This is my cases. After naman po is malalaki po ako ng waterproof pad or towel po under the body part po ng patient na affected if appropriate po since we have to protect the ligaments din po. So we have the waterproof pad. So ilalagay ko siya sa area po. Yan. Next naman po is I'm going to apply, submerge ko po muna yung gauze pad or towel po dun po sa basin na may cold or yung ice po, and i-ring out ko po yung excess na moisture. So, this is the towel that I will be using. Nandito po yung cold. Then, i-place ko siya dito. Then, sasubmerge ko po siya. After that naman po, is i-apply ko na po yung compress sa area po, then i-mold ko po siya doon sa side po. So, dito po. Okay lang po yun. So, ayan po. Na-apply po siya. Kaya ako lang din na ma-feel po yung compress. And, since na-compress natin natin, hindi po siya cold po yan. Nalalamig pa. Kaya pa naman po. Okay? After that naman po, is i-remove natin and i-moist natin. And also, i-apply natin po to maintain po yung cold temperature as needed if necessary po. So, yung po po ito, sasubmerge ko po. And i-mold ko po ulit dito sa aquarium. So after that is, i-check ko naman po yung skin condition at the appropriate and regular intervals. So for example po, every 5 minutes, i-check ko po if may pagbabago po ba dun sa kanyang skin, whether if may redness po ba or natatanggal po yung swelling. So as I've checked naman po, natatanggal naman po yung swelling na natanggal po. And pero i-check ko din po, or the next procedure is, isa-stop ko po yung application immediately if meron pong problem naman. For example po, redness po dun sa, or excessive redness po dun sa side. So, since wala na po redness dun sa side, I will proceed with removing my gloves and dispose properly po and perform hand hygiene. So, remove ko po po. Sabi lang, dispose ko po properly. Then, after that, hand hygiene po. Then, i-help ko po si client sa comfortable position. So, tanggalin ko muna po yung underpad. Since tapos na po yung application, then i-dispose. After that naman po is, hindi nga po i-help ko si client ng comfortable position. Comfortable naman po kayo dyan. Okay, now naman po is, i-remove ko na po and i-clean, dry, and store po yung disposable supplies and equipment accordingly. So, remove ko na po yung underpads niya po kanina and na-dispose ko na po. Next naman po, i-inspect ko po yung body part of the wound condition for evidence of effectiveness, part of therapy, and sensitivity to touch. So, check ko na po yung area po ni client na nilagyan po natin ng cold compress. Kung mayroon pa po siyang sensitivity or yung effectiveness po ng therapy. Sa scale po ulit ng 1 to 10, yung 1 yung pinakalawas, at yung 10 yung pinaka-highest, gaano na po siyang sakit or nabawasan na po ba? In a rate of 1 to 10 po. 1 na lang po. So, since nawala na po yung pain, medyo, but yun po yung conclusion na effective po yung ginawa pong therapy. Next naman po is, i-describe po natin yung i-ask sa patient to describe yung level of comfort niya and burning sensation following the treatment. So, magkano naman po yung level of comfort niya? Like, wala na po ba talaga yung pain and wala na po kayo nararamdaman na burning sensation? Wala na po. Salamat po. So, next naman po is, i-identify ko po yung any unexpected outcome. So ma'am, if ever po na after po this therapy, meron po mga unexpected outcomes like yung pagpapatuloy po ng pagmamaga and yung pagkakaroon po ng redness, itching, sabihin niyo lang po sa amin or inform niyo po yung healthcare provider niyo po if that occurs po. Will that be okay with you, ma'am? Okay, thank you so much. Next naman po is I will document po and report yung all pertinent information of the procedure that I performed. So, na-document ko po yung site nung aking apply ng cold compress, yung time po na pag-apply, yung order po ni Doc Ben, and yung character po ng swelling po ng kanyang yung kanyang area po, and yung naging outcome po. And that will be all for applying cold compress. Thank you po.